What does a benign lung cancer biopsy mean? Imagine going for a scan because a spot showed up on your lung, and then having a small sample taken to find out what it really is. When the biopsy results say the nodule is benign, it means that the tissue sample taken from that spot does not contain cancer cells. In simple terms, the abnormal area in your lung is not cancerous. This is good news because it suggests that the lesion is non-malignant, meaning it is not an invasive cancer. A lung biopsy is a procedure where doctors remove a tiny piece of lung tissue to examine it under a microscope. They often use imaging techniques like CT scans or ultrasound to guide the needle or instrument precisely to the suspicious area. The sample is then checked by pathologists to identify what kind of cells are present. If the report says the cells are benign, it means they do not show the uncontrolled growth or invasion typical of cancer. Benign lung nodules can be caused by many non-cancerous conditions. These include infections, inflammation, scar tissue, or other benign growths. Sometimes, these nodules are discovered incidentally during scans for other health issues. It is important to understand that a benign result does not always mean no further action is needed. Doctors usually recommend monitoring these nodules over time with periodic imaging to make sure they do not grow or change. In some cases, a biopsy might reveal precancerous changes, such as atypical cells or early-stage conditions that could develop into cancer if left untreated. If that happens, your healthcare team might suggest additional tests or preventive measures to reduce the risk of progression. The method used for biopsy can vary depending on where the nodule is located. It might be done through bronchoscopy, where a flexible tube is inserted into the airways, or through a needle guided by imaging, or even through surgery if needed. Getting a benign diagnosis is reassuring because it means there is no current evidence of cancer. However, it is still important to stay vigilant. Regular follow-up with your healthcare provider is essential to monitor your lung health. If symptoms develop or if imaging shows any changes, further testing might be necessary to rule out any new developments. In summary, a benign lung biopsy means the tissue sample taken from your lung does not contain cancer cells. It indicates a non-cancerous condition at the time of testing, which usually leads to a plan of observation rather than aggressive treatment. But ongoing medical follow-up is key to ensuring your lungs stay healthy and to catching any future changes early. Always discuss your results thoroughly with your doctor to understand what they mean for your specific situation and to plan the best course of action for your lung health.